Well, hello, Pahrump. This is Dr. Michael Reiner, and this is the abbreviated live version of the show. I had difficulty getting out of the office tonight, and since the new year has kind of started, we've kind of been in a rush, and so I've missed the past couple of shows after the holidays. So I'm sure that people are getting a little tired of watching some of the reruns. But anyway. We're here, and so again, that call in 727-8750, and I think they said they were having a little difficulty with the live portion of the show, meaning the call in. So if you do call in, our producer will answer the phone, and if I can't hear the conversation, he will relay the question, and hopefully we can get that answered for you. So with the beginning of the new year, nothing much has really changed except for the fact that we're just as busy as we can ever be, and that always presents challenges in the office for myself and all the staff included. But one of the things that's kind of come to my attention, at least in my own office, and I know my patients who watch this show, we've had some, and I don't claim to be perfect on any stretch of the imagination, we've had some customer service issues at my office, and I've tried to address those with my staff, and so I'm hoping that they do get addressed. But if you are a patient of mine and you find that you are not being treated with the utmost courtesy and respect, please do one thing and one thing only. Get the name of the person that you talk to, so that when you do have a chance to talk to me about it, I can tell that to that person directly. There's nothing worse for me than to hear a complaint about how someone was treated in the office and then not have a name to stick with that complaint so that I can deal with it. So I hope that that's kind of a bit of a, airing a little bit of dirty laundry, but being an independent practitioner, it's just one of those things that I do have control over my staff, and if they don't like their particular job, then we can ask them to find another one. So one of the things that comes up at the beginning of the year is the idea that this is a good time for everybody to get in to the doctor, especially if you have some of the chronic diseases that we've talked about, and schedule what we call a general wellness exam. And those are good things to get out of the way in the early part of the year, just so we can go over your health history. We can talk about any screening test that might be done to get you scheduled for the things that might make a huge difference in preventing the diseases. As you know, I do participate with Senior Dimensions and United Healthcare with regards to their HMOs as well as their PPO products and the like of the sort. One of the things that takes place is that they're big on screening tests. Okay, so we have our first live call, and let's see, this is Louis. What's it called? The thyroid gland to swell in the throat. Okay, so Louis asked, what causes the thyroid gland to swell in the throat, and what can be done about it? Okay, so if it's the thyroid gland that's swollen, then that's one issue. If there's other issues, there's a lot of things in the throat. Obviously, you have carotid arteries, you have nerves, you have the swallowing pipe, and then you have the thyroid gland, which sits right here. If you're a male and have an Adam's apple, it usually is right around in that area there. The most common cause of thyroid gland swelling is goiter. Goiter is basically a term for the gland becoming enlarged because it is trying to make more thyroid hormone. And one of the response to that is to hypertrophy or grow the gland in order to produce more thyroid. That can come from a lack of thyroid gland production, or maybe come from a lack of iodine. Most of us use iodinated salt, so we really don't get we really don't get a lack of iodine causing a goiter. The next common cause might be some form of thyroiditis, meaning an irritation in the thyroid gland. And this is Hashimoto's disease, very common and more common in females, more common in the mid to late 40s to 50s. And the thyroid gland becomes a little irritated from autoantibodies. Your body makes antibodies against the thyroid gland, and it basically becomes irritated, and it can produce more thyroid, and you can get, thyroid toxic states where you get this thing called exophthalmos, where your eyes kind of bug out, and that, by the way, is an irreversible condition should it develop. You can get hyperthyroidism from that particular type of issue is very easily treatable, and it usually requires you taking some prescriptions to get that under control before it does damage to your heart and some of your other vital organs. It's just like being on a revved up pill. It's just basically you'll be very hot when others are cold. You might be sweaty. You might lose weight in the end stages, so that's one thing that can happen. The other side of that is obviously the myxedemic state, the hypothyroid, low thyroid can come because you don't make enough TSH, or your body there's some other defect that's taking place, and you'll get somewhat of a goiter. So when people have hyperthyroidism, the complaints usually are just the opposite. If you're hypo, you may be cold intolerant. You're going to be cold when others are normal temperature. You may lose hair. You get the thinning of the eyebrows, which is called myxedema. Then you get, and you can actually get swelling of one extremity versus the other. It's one of the only cases of which you get unilateral edema, which is hypothyroidism. And again, the hyperthyroidism is heat intolerance, sweaty pallor. You may get palpitations, you'll get the exophthalmos, and you'll lose weight. So that's why people associate when they gain weight that they should be hypothyroid, they should be low thyroid, and that's absolutely not the case. That is not the issue. Okay, so we'll finish that, and then we'll get to these other questions. So I wish we could fix the phones, but it's good because then people get to call in their questions, and hopefully we can get to them all. We obviously have thyroid cancers that can cause swelling of the thyroid, and by the time you see a very large nodule in the thyroid gland from a cancer, it may be somewhat too late to do anything about that. Usually we pick them up on subtlety. Someone might feel a small little nodule, or they might press that, or they'll do a carotid ultrasound looking at their arteries, and someone will see an enlargement or a cyst or something along that line. And usually we don't worry about thyroid cancer until the nodule in your gland becomes greater than 1 centimeter squared, meaning 1 centimeter height, width, and depth. And then those are thyroid cancer until proven otherwise. And then what we do is we get a thyroid uptake scan where we give you radioactive iodine. It's like, well, if we're worried about cancer, why are we giving you a radioactive substance? Well, it's obviously a very short-acting radioactive substance, but it gets incorporated in your thyroid gland, and the gland that's actively takes up the thyroid gland, and the gland and the part that's not, if it's called a cold nodule, meaning it's a area that doesn't take up any thyroid, then it's probably thyroid cancer, and usually they go in and do a biopsy and remove that. Can you get by with half a thyroid or a small thyroid? Yes, you can. We can always supplement that thyroid hormone if that's what we need to do. And so that pretty much, I hope, covers the gamut of problems with thyroid swelling. But the main thing to do is get in and get it checked, get your doctor to order some tests, and usually we become aware of what the disorder is. Okay, so let's see. So Chris is asking, what kind of drugs can be used for dementia? Well, there are really two main drugs on the market today. Basically, there are a product along the lines of Aricept and those particular products, which they call Razidine is one of those, and a few other. They hopefully, maybe sometimes when they do a biopsy on people with dementia, they find neurofibril tangles, or the nerves kind of get tangled up in each other, and there's a increase in deposition of some deposits of amyloid and a few other things in there. And hopefully one of those products actually along the line of Aricept happily to delay the development. If they don't take it away, they slow it down. And that's the problem with these medications in dementia, is that all they're basically meant to do is slow the process of the disease. They're not meant to be corrective or curative. And that's what people need to keep in mind. And sometimes family members say, well, they're on the medication, but it's not really helping. One of the drugs, Namenda, which is different than the drugs Aricept, are used together because they work differently. Namenda works on a sodium channel in the brain, and it helps to, I think it's a sodium, it's maybe a potassium channel, but it works on one of the ions which transported, and it helps to increase and preserve the neuro synapse and the endings, and that one probably is a little longer acting. The average duration of these medications is about, really, and I know it sounds kind of interesting, about 18 to 36 months, which is about 2 to 3 years. And after that, the effects seem to taper off. But if you can delay someone from entering a nursing home or entering a tertiary care center for 2 or 3 years, then you have made a nice impact on the disease. Basically, they're not meant to treat it. There's Aricept, Razidine, I think a few others, and Namenda, and those have helped some people. Use them together; they are effective. It is a 1 + 1 = 3 phenomenon, as opposed to taking one of those medications individually. And you start one, work on up to it, and then you start the other one to make sure that you can tolerate it. Let's see, Ray, can a cold progress into pneumonia? And what could treat this? Antibiotics won't treat the cold. Well, that's very, very true, Ray. And about 1 in, I think, 10 colds can sometimes end up in a pneumonia. And that seems to be the statistics behind that. Certainly, there are predispositions to that developing a pneumonia, and it's a cascading event, which means in order for a pneumonia to develop, you have to be susceptible to it. The airway in the lung has to essentially close off and not become aerated, either through a mucus plug or something along that line. And then as the lung kind of collapses on itself, it creates this low oxygen called an anaerobic environment. And then that anaerobic environment promotes the bacterial growth, and boom, you're off to developing a pneumonia. How would you, and a lot of colds do go down into your lungs, and they cause a bronchitis, and then sometimes that may progress into a pneumonia. Certainly if you have COPD, if you have one of those chronic lung conditions, you're very more likely to develop a pneumonia with a common cold than the average person who just develops a common cold out in the clear blue, out of nowhere. What's the differentiating deal? So if you get a cold and you start to develop a cough, and that cough is kind of clear, maybe a little brown, maybe a little green mucoid, that's probably okay. If you start to develop a productive cough, which is yellow, spiking a high temperature to 101 or greater, then you could very well be developing a bacterial pneumonia. And certainly if you're getting fever, rigors, shakes and chills, those are also could be reliable signs of pneumonia, and you want to get in there. Obviously, if you're one that has COPD and will develop a pneumonia easily, then you want to get into your doctor right away when you develop an exacerbation of that illness, because you are going to be more likely. If you're a smoker, you're going to be more likely to develop a pneumonia with a cold because of your decreased mucus clearing mechanisms that develop from the cigarette smoke. And those are issues that, if you're susceptible to that. So the pneumonia vaccine, I know we've talked about that before. If you haven't gotten one, get the Prevnar 13, followed in a year by the polysaccharide 23. It does cover some of the strains, but doesn't cover them all. Again, I think, we're going to go to break here, and when we come back, if I answered your questions from the previous thing, then feel free to rest the phone down, but if I didn't, please call back, and we'll bring up the pneumonia issue when we come back from the break. Thanks. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.